Moving on, now India has confirmed 7 cases of human metapneumovirus, also known as HMPV infections. While the Union Health Minister JP Nadda has assured the public that the situation is under control and that there is no risk of a COVID-19-like outbreak in India. The question being, should you be worried? Let's break it down for you. Now, all of the cases in India so far have been reported in children, with cases identified in Bengaluru, 2 cases in Bengaluru, 2 in Tamil Nadu, 2 in Nagpur and 1 in Ahmedabad. Now in Bengaluru, a 3-month-old baby had been discharged and an 8-month-old who is recovering at a hospital. These were the 2 cases like I mentioned. Meanwhile, a 2-month-old was also found infected in Ahmedabad. Meanwhile, in Tamil Nadu, 1 case each has been reported in Chennai and Salem. And in the latest, 2 children aged 7 and 14 have been tested positive in Nagpur, increasing the total number of cases of the respiratory illnesses to 7. So 7 HMPV cases in India so far. Now, the rise in cases in India comes amidst a surge in respiratory illnesses in China. There is currently no evidence that the outbreak is out of the ordinary or that a new respiratory virus or illness has emerged in China. The symptoms of HMPV are similar to those of flu and other respiratory infections. Let's take you through the symptoms of HMPV. Number 1, cough, fever, nasal congestion, shortness of breath. And in severe cases, it can also lead to bronchitis or even pneumonia. Now, HMPV can spread through secretions from sneezing and coughing, close personal contact, and touching objects that have the virus, and then touching the eyes, nose, or mouth. The virus has an incubation period of 3 to 5 days, and that poses a higher risk to certain groups, which includes younger children under the age of 5 and elderly, that's above the age of 65, and also individuals with weakened immune systems. So they are vulnerable to the spread of HMPV. There are currently no antivirals to treat HMPV, so treatment consists of providing supportive care to patients with moderate or severe symptoms in this case. Now, the Indian Council of Medical Research is monitoring the situation. The ministry has urged the citizens to follow a few steps. Number 1, cover mouth and nose while sneezing or coughing, washing hands with soap, and also avoiding crowded places. Meanwhile, the ministry has advised people to cover their mouth and nose like I mentioned, also use tissue paper when you're coughing and sneezing, wash their hands with soap and water or any alcohol-based sanitizer. And also stay at home and limit contact if sick. And also drink plenty of water and eat nutritious food. So these are some do's to keep HMPV at bay. Further, the ministry has advised people against reusing tissue paper and handkerchief coming in close contact with sick people. Apart from that, frequently touching eyes, nose and mouth, spitting in public places, self-medicating without consulting the physician. So these are some don'ts to keep the HMPV at bay.